I got this message from one of my followers, and I agree with everything that's written in here. I'm Dr. Nagat Arif, a GP with a specialist interest in women's health and the author of The Knowledge, Your Guide to Female Health from Menstruation to the Menopause. And absolutely, as my followers written to me, 1 in 10 women suffer from endometriosis, but very few people know about it. So I'm going to take a right nosedive into endometriosis. And some of you might never have seen endometriosis, but on this model, it can grow particularly anywhere. I'm going to share with you the latest we know about endometriosis. So women like that person who left that incredible message for me does not have to wait 10 years to get a diagnosis of her endometriosis. So listen to me really carefully. Endometriosis is a chronic systemic inflammatory disease that affects the entire body, not just a single organ or body part where we concentrate it around the womb. Endometriosis is a condition where cells similar to the lining of the womb grow outside in other places, such as the ovaries, the fallopian tube, even in the vaginal canal, around the cervix, and in the womb itself. But research has shown that inflammation from the endometriosis can activate white cells and create inflammation throughout the whole body, making it an inflammatory systemic chronic disease. Part of the problem is that endometriosis is not a straightforward disease, but now researchers are learning that it can involve multiple organs and go across the entire body. Now, it's really misleading because the disease itself gets the name from endometrium, the lining of a woman's uterus. In endometriosis, the tissue similar to the lining of the uterus go outside of the uterus. So for those of you that don't know what a uterus is, that's the uterus, so that's the womb. The endometrium can also grow outside the uterus, on the bowel, as well as behind the uterus and elsewhere. So let's look at what happens during a normal menstrual cycle. The endometrium thickens and then it sheds through the cervix, and that's why we have a period. With endometriosis though, the tissue goes outside the uterus and it's shed into the abdomen. The shedding then occurs each month with menstruation, causing pain, inflammation and scar tissue, which is why the condition causes painful and sometimes can cause heavy periods, but also cause scarring on the inside. And the endometriosis lesions, or the endometrial lesions, can wrap around your bowels, your bladder, your pelvic organs, and cause immense amount of pain, even though that you don't have a period at all. It can also cause back pain, pain on deep penetration if you're having sex as well, even pain on having a tampon inserted as well. This is chronic pain that affects and debilitates women. So how do you get a diagnosis which is made quicker and doesn't take 10 years? Well, I would say focus on the woman's symptom and her history, especially if a woman or a girl is complaining about pain worsening over time. Endometriosis is a progressive disease. Now, your first period at the age of 12 should be the bar, the baseline for what your periods are like and what they feel like in terms of pain. If menstrual cramps are getting more painful, then that isn't normal. Cyclical pain that is progressive over time is almost always endometriosis, even though you might have a normal scan, and that is the key thing. A normal scan, a normal laparoscopy, a normal MRI does not rule out the diagnosis of endometriosis. It's purely based on symptoms, and that is what we should do. Listen to women, believe women and girls when they complain about the heavy, painful periods. And the reason it's so important to take endometriosis so seriously is because now we've got data and research showing that it's an all-over systemic inflammatory condition. This article here has shown that microRNA molecules which help control gene expression differ in women with endometriosis. So that means it can travel to different organs for different women and have almost like a hormone effect. And that shows that microRNAs are the major signaling mechanism that creates this whole body effect. As of yet, there isn't a simple test to diagnose endometriosis. It's by symptoms and listening to women alone. The earlier the diagnosis, the better chance that we can have by giving her quality of life back, but also making sure that we preserve fertility for later if the woman or the girl chooses to have children. When it comes to treatment options, we have non-hormonal treatments such as mefenamic acid, which can reduce the pain. It's type of non-steroidal anti-inflammatory, a bit like ibuprofen or Nurofen. You can also have tranexamic acid if you're having heavy bleeding, and that can reduce the flow for you. The next step is to consider hormonal birth control, which can help reduce or stop your periods or reduce the inflammation around an endometriotic lesion. The other option that I use with my patients is progestin, which alters the hormone that causes the growth of the endometrium and the spread of these cells within the abdomen, therefore reducing the size of endometriotic lesions. Now, surgery can be considered to treat endometriosis, especially if we're thinking along the lines of preservation of fertility. So a laparoscopic excision surgery, some of the results can be hit and miss and can cause adhesions. So although it can work for some of my patients it doesn't work for, and then they need further surgeries down the line. It all depends on where the patient is in regards to their biological and family planning journey as well. We do have more data that's coming out. So the first non-hormonal trial is dichloroacetate, which is being run by Wellbeing of Women to look at how we can preserve fertility, growth of endometriotic lesions without using hormones. So that trial is ongoing at the moment, which shows promising signs. The biggest take-home message to this message, I would say, is that please keep raising the flag, keep raising the awareness, keep getting online and talking about your symptoms, because we learn as doctors from your lived-in experience. It's so important that we carry on doing this to break away the taboo around painful periods, to make sure that research keeps happening, because then people are invested in making sure that funding goes into that, and understand that endometriosis isn't just something that affects reproductive organs. It's a chronic, systemic, lifelong disease which can affect the whole body, and it's an inflammatory condition that affects the whole body. I wish I had more fun things and positive things to share with you. I'm so sorry. But keep following for more information.